in few seconds we'll be live, sir. I'll tell you the moment we're live. So first, you please also check now at your end on YouTube.
Mine is recorded.
Yeah, we are live, sir.
So this is session number 9 for us. Sorry, session number the 10th session.
10th session. Okay.
And until now, we've not been putting it on YouTube.
Right.
Onward, we're going to be also airing it live on YouTube.
Sure.
There are some people who have some issues with Zoom.
Yeah.
You know.
Have you ever done a session on end-of-life care, Pradyuman?
No, we haven't.
Oh, if it's a senior group citizen, I would strongly recommend it. It's a very, very fascinating topic and should be discussed, I think. Yeah. If you think appropriate.
I think it's see, we've been looking at, the regular kind of issues so far.
Right.
We looked at one issue which is concerning masks, yes. In between.
Right.
But the questions, the areas that we've been looking at is regular, but clearly, that is one area where there is a need. Palliative care, there's a fair amount of things just to kind of talk about those issues. So, Ashish, are we live?
Yes, sir, we are live. Good to go.
Hello and welcome to Health Live at Seniors Today. We are here for another session of Health Live with a doctor in the house. Today we have Dr. Sujeet Rajan, who's a consulting respiratory physician. Dr. Rajan is a graduate from the Grant Medical College in Mumbai, and he post-graduated in respiratory medicine from the GS Medical and KEM Hospital. He also holds a diploma in environmental tuberculosis and respiratory diseases from the College of Physicians and Surgeons in Mumbai. Following his post-graduation, Dr. Rajan has been actively involved in research and clinical practice at the Bombay Hospital and Bhatia Hospitals, which are both in Mumbai. He's also the Indian editorial advisor for the American Journal of Respiratory and Critical Medicine and has over 38 publications to his credit. Welcome to Health Live at Seniors Today, Dr. Rajan. I would request you to say a few words to our to the audience here, and a request to people here: please post your questions on the Q&A tab. I must also tell you that from today onwards, Health Live at Seniors Today will also be live on YouTube. Our YouTube channel is Seniors Today, so you can visit that. You can pass on that information to people, and please post your questions at the Q&A tab. And over to you, Dr. Rajan.
Hi, thanks, Pradyuman. Thanks. It's a pleasure, a privilege to be here today and discussing issues related to both senior citizens and lung health has always been one of my passions. Educating patients has always been, to me, a challenge. It's easier to teach respiratory physicians what you know and what you've read about, and it gets more difficult to talk to primary care physicians, and most difficult to simplify things to patients. And I think that's a subject that I have been quite interested in as to how to make a complicated illness of the lung as simple to understand for patients. So I hope we can address some of those issues for your viewers. My background is basically respiratory medicine, and my interests have been lung fibrosis, largely airway disease and sleep disorders. I'm more than happy to take as many questions as possible in the time we have, Pradyuman. So please go ahead. And I would also like to emphasize that we are in a time where respiratory practice is changing significantly, in that we are seeing hospitals less full with non-COVID patients. And what is fascinating about that is that I was one who always believed that hospitals were quite full of patients who didn't need to be hospitalized. And I think that is an interesting change we are seeing, in that those who really need to be in the hospital are actually coming in. Having said that, it has been a big challenge for people who haven't a problem, but who need a COVID swab to get into the wards. So that's been one challenge. The second thing is that people have been very clear about taking appointments now. Urgent appointments are much less often. I get much less SMSs on urgent appointments. And I think there are less relatives in the hospital. We have a crowd of relatives now, have always had in the hospital, about half a dozen relatives sometimes with the patient, and therefore half a dozen multiplied by half a dozen questions to deal with. So now it's quite nice to tell one relative who's with the patient that get all the questions in and we'll answer them at one go. Obviously, it's a challenge for patients in the COVID wards where asking questions has to be then telephonic only. And that is a challenge. But we're seeing a dynamic in practice today that is completely different. And people believed in March, April that things would be back to where they were. I think they were never normal in a city like Mumbai, and I hope we're moving to a new playing field moving forward. So, over to you.
Respiratory physician, these must be exceedingly busy days for you.
Very busy, very busy. There are 3 branches in our hospital that are busy right now, and which is general medicine, respiratory medicine, and critical care medicine. These 3 branches are really stretched right now in almost every hospital across the city, Pradyuman. But it's a challenge, you know, and I think for anyone who likes a challenge, we're trying to see how best we can manage it and hoping that we will get slightly less physically and mentally demanding schedules in the months ahead. But right now it's a big challenge.
You know, doctor, over the last 3 months, I bought myself a new gadget. There was no shopping being done, but I got myself this gadget, which is called the pulse oximeter.
Right.
Now, I have a lot of questions over here on the oximeter. First of all, how accurate is it? And, you know, can you really trust it, or do you need to take readings from 2 or 3 of them? If my reading is 94 or under 95, is it something to worry about? What can I do? Etc. etc. So quite a few questions which I would like to address with just this opening.
Sure. The pulse oximeter is like it's like a vital sign, you know, and as respiratory physicians, we have been using a pulse oximeter in practice routinely. There is no patient who comes to my clinic even before COVID who doesn't get their oxygen saturation checked. Having said that, it can be a little stressful to keep checking your oxygen saturation. If you've got nail polish on your finger, or if you've got a cold finger because the room is very cold, you're going to get a slightly lower reading because it's based on the circulation of blood in that finger. So I would just caution a lot of people who are viewing in not to keep checking it every few minutes or hours. I would say once or twice in a day if you're stable, or even once in a few days if you have no symptoms. And at sea level, which is Mumbai, I can speak for Mumbai. At sea level, the normal oxygen saturation in most healthy people is above 95%. Just because it's 94%, you don't need to panic, Pradyuman. If you're overweight, you got a big paunch and you're lying down, your diaphragm is going to push up on your lung and drop your oxygen saturation a little bit. So you know, you could have a 94, 93 if you're lying down. And if you know about sleep apnea and snorers, they're the people who could even be 92, 91 lying down sometimes normally. So there's no need to panic just because you have one of those readings. But of course, if you're breathless, unusually breathless, you have a fever as well, then a variation in that saturation going below 95 is certainly something to be concerned about, sitting upright or standing. Going below 90, I would certainly be concerned. And any oxygen saturation that drops on walking. So if you got a saturation of 96 at rest, but you walk for a few minutes and it goes below 90, that's not a good sign for sure, because that means your interstitium, or the lining in the lung, which transfers oxygen into your blood, is affected. And that's what COVID affects, or any interstitial lung disease affects. So there you go. Normally our oxygen saturations on walking should actually go up because we're ventilating more, we're breathing harder. But that's another good warning sign.
So a question related to this is, what do I do to ensure that my oxygen levels are stable and they go up?
So there's nothing you can do. If they go down, you need to contact your doctor. And especially if you've been checking it often and it's been above 95 or above 95%, and suddenly you see readings below 90, I would contact, but I wouldn't panic. Panic makes you breathe faster. And then Pradyuman, if you breathe faster, you're going to get even less oxygen getting into your blood. So you will drop further. So it's important to calm down, breathe slowly, and contact your doctor. Your doctor's probably going to ask you certain questions like, what's your pulse rate? So some people have a chronically low oxygen saturation at say 93, 94, just because they're grossly overweight or they have chronic lung disease. Those patients, if they go to 92, 91, I wouldn't panic that much. But if a saturation is 90 or 88, and they cannot handle that oxygen saturation, their heart will start beating faster. So the pulse rate, which is always there on the pulse oximeter, will start going up. So low saturation, high pulse rate, that's where you need to take care. Likewise, if you have a saturation of 95 or 96 and your pulse rate is 130, there is something wrong. So you're obviously, your heart is beating faster to maintain that oxygen saturation. So don't have a false sense of relaxation just because your saturation is over 95. Don't ignore your symptoms. The symptoms are equally important.
There's one more question which is coming. There are apps which are also available on the mobile phone for checking the oxygen and blood pressure. Are these safe and dependable?
No, I wouldn't recommend apps on a mobile phone to check oxygen saturation and blood pressure, for sure. I would rather invest in a blood pressure instrument. I'm not aware of their accuracy, at least I am not aware. I'm not sure if any cardiology colleagues or physicians would be aware, but I wouldn't go with those apps. I would rather buy a simple finger pulse oximeter or a good either Omron or Panasonic. Those are reputed brands of a blood pressure instrument to use at home. I think 3 or 4 instruments at home are very important here. A good thermometer, ideally no-touch thermometer, a blood pressure instrument, a glucometer for those who are diabetic or borderline diabetics, and a pulse oximeter. I think these would be good instruments to keep at home in all households where there are elderly people.
Okay, I think we are done with these questions. There's one question again, which I may as well ask, because I think a lot of people may be having this question, is what do you recommend? Which brand of oximeter do you recommend? Because they're available from rupees 600 to 1500.
I agree. That's a tough one usually, but I think any brand that you get at a retail chemist is okay. A lot of these are made in Taiwan and China. They're pretty okay, I would say. If you get readings which are not matching your clinical symptoms, you probably got to check it. Some of the reputed brands are Nonin. Nonin is one of the most reputed brands, but it's a little more expensive at about 9 or 10,000 rupees as compared to the prices you mentioned. But again, I wouldn't recommend everyone to go in for a branded one. I think the non-branded ones are pretty accurate.
We have a question from a person who's asked me to ask it anonymously. If there's a patient of TB in the house, what precautions should other family members need to take? Earlier, the patient was having a lot of coughing, but now, with the start of treatment, the cough is much better. How big is the potential to get the infection to other family members?
So tuberculosis is infectious only if it's in the lung and the sputum is positive for TB bacteria. Those are the only patients who are contagious. So if your doctor hasn't spoken to you about this, what I would suggest is first check with your physician whether you have drug-sensitive TB or drug-resistant TB. That's very important to understand. If it's drug-sensitive lung TB, then in about 3 to 4 weeks of using the right drugs, you are non-infectious. But if it's drug-resistant TB, it can take up to 9 to 10 weeks to become non-infectious. So important question to understand is drug-sensitive or drug-resistant, and getting your sputum checked is very important. Or if you're not being able to check your sputum, a bronchoscopy test or a tissue biopsy of the lung to understand what type of TB it is, drug-sensitive or drug-resistant. Having said that, if someone is coughing in the house and has TB, he is not infectious if he's past that 4-week point in drug-sensitive TB. So after a month, he's very less infectious. At the same time, if he's coughing, you may want to just check that he's responding well, repeat an X-ray maybe. And if you sit together with such a patient in the same room, keep the windows open and avoid sitting for prolonged periods, close contact. The same precautions you take with COVID actually for infectious TB.
We have a question from Suresh Taparia.
Yes.
Who says, do seniors have to use a face mask if they are in the house all the time? There are two more questions. What is the quarantine period, time period for self-isolation? If more than one person in the same family is contracted with the virus, can they be in the same room for isolation?
Sure. So on the face mask, I think if everyone's living in the same house, I don't think it makes sense to wear face masks at home. I think it's taking it a bit too far and very discomforting on the quality of life. Having said that, if there is one person in the house who is stepping out very often, I would just encourage physical distancing from that person as much as possible. So if there's one person constantly going out to work, especially in a hospital, in the period of the pandemic, I would say stay about 6 feet apart. You know, as I avoid hugging, kissing, and intimacy with that person, because you never know if he's or she is an asymptomatic carrier. So otherwise, I think masks in the same house do not make sense. The second question was on if people...
Sorry to interrupt. Is this only for senior citizens or is it for everybody?
Everyone. So masks in the same house do not make sense. So
if there is somebody who's going out in my apartment,
yes,
I'm not a senior citizen, but do I still need to be careful about the distance?
I would say if that person is going out frequently during this pandemic and with the current numbers, a little bit of physical distancing helps. Because you never know when that patient or person is an asymptomatic carrier. And asymptomatic carriers are a huge source of infection, you know, which is why we need to counsel our children and youngsters in the house not to step out and meet new people every day too often unless really necessary. Because even though they may get COVID and escape with it very easily or with mild symptoms, they're going to pass it on to some elderly person at home, which can be a disastrous, you know, and I think that is important. Because a lot of people want to go out, step out now, especially the youngsters. And I think a little chat with the younger people in the family about this, and hopefully they don't behave like I saw in an American video. I prefer my Budweiser over a grandparent, you know, and that is horrifying, you know. And I think that is something our Indian society and cultures, fortunately, we see less often.
The other two questions were, what is the quarantine period for self-isolation, and if more than one person is contracted with the virus, can they be in the same room in isolation?
I think if the whole family, so I've had one consult with the whole family who was down with COVID-19, parents and both their sons, I think they can all live in the same house, no problem at all. Absolutely no problem. And we don't know the viral load, of course, with which each one has been infected. But some degree of distancing is good, but you know, they can live in the same home, just like we have a COVID ward, no problem there.
We have a question from Haresh Tekchandani, who says, I'm 70 years old, detected lung fibrosis since last April 2019. ILG, what precautions should be taken by me? I'm taking Perfenex 400.
How many times a day is he taking Perfenex 400?
No, he hasn't mentioned that.
Okay, so as a lung fibrosis, an area which I really am interested in and which I spend a lot of time in, Pradyuman, I'd like to know first what type of lung fibrosis it is. If it's IPF, which is idiopathic pulmonary fibrosis, then the dose of pirfenidone is 1,800 milligrams a day minimum, to a maximum of 2,400 milligrams a day. So with a 400 mg tablet, you will need to take at least 4 to 5 tablets a day to get onto the minimum recommended dose. So I'm not sure what dose he's taking. Having said that, it's easy to use a 600 mg tablet, which is available now, and take it 3 times a day. So that would be the minimum effective dose. Lower doses than that, we do not recommend unless you can't tolerate the minimum dose.
We have a question from Liaquat Kazi, who says, I'm 55, I have breathlessness occasionally. When I sneeze or when I pass air, I feel free from breathlessness. What should I do?
So I have a feeling this patient probably has a blocked nose. Okay, and I think if he sneezes and he clears the nose, the nasal obstruction goes, and that's how his breathing is relaxed. A lot of people feel breathless with just blocked noses, and then they tend to mouth breathe. So the important thing there is to clear the nose. And if it's allergic rhinitis, which is frequent colds, either runny nose, blockages, or sneezing, frequently in a year, then the treatment of choice is a regular nasal steroid spray. If once in a while you get a bad attack of that rhinitis, you need this nasal spray for about 10 to 14 days. And if it happens just almost every day I have a cold, that is called persistent allergic rhinitis. And then the patient needs to take the nasal spray every night at the lowest effective dose after about 8 weeks. It could be even alternate nights that you need to take the spray, but the nasal steroid spray is the mainstay of treatment in allopathy.
Vinita Chandra asks, is it good to use a respirometer for senior citizens?
What is a respirometer? Respirometer.
Respirometer.
Does she mean a peak flow meter or a breathometer, maybe? I don't know what she means by a respirometer, but a peak flow meter is what we would advise an asthma patient to use.
Right.
And that's a simple instrument in which you blow out, just like you monitor blood pressure and diabetes with a blood pressure instrument or a glucometer. The peak flow meter is meant to monitor asthma, and every asthma patient should keep one. Respirometer, I've not heard of. The other thing she may be referring to is an incentive spirometer, which has 3 balls, and you breathe in for your chest expansion. That is again useful for post-operative patients or patients recovering from COVID infection. The incentive spirometer is very good because it expands your lung and allows more oxygen to be entrained. And that's it. And a spirometer is a lung function instrument, so I'm sure she doesn't refer to using a.
Perhaps she must be watching right now, so.
Yes.
So she will.
Could she specify exactly what it is there? I've not heard of what is a respirometer really. I think it's a breathometer or a peak flow meter.
We have a question from Jyoti Taparia who asks, sleeping on stomach and doing that a few times a day, does that help you to increase your resistance and immunity?
No. There is no evidence to show that sleeping prone, which is on your stomach, improves your resistance or immunity. We've heard a lot about it in recent weeks because patients with COVID pneumonia have drops in oxygen, and when you prone them, then the dependent area of the lung is there is a distribution of perfusion, and so the patient's oxygen saturation improves, just turning the patient upside down. And so we do that till the patient recovers naturally. And so prone positioning has received a lot of attention, but it is not a recommended position of sleeping to improve your lung function.
Thanks. We have a question from Nalini Gupta, and quite a few questions which are obviously because of the COVID scare. Can senior citizen couple, 65 plus, go out in the evening for a walk in a park or a road?
I think so. I think it's not a bad idea for senior citizens to keep themselves physically active. Pradyuman, quality of life when you're old is directly proportional to your physical activity. So if there's one message I need to give everyone is that as you grow older, the less physically active you become, the more sick you become. Simple. Now, having said that, going out for a walk, if there are multiple people around very close to you, is not exactly the safest thing. And I would advise at least a simple cloth mask then, not an N95 mask. And I think if there are few people in the park, it's much safer. Staying 6 feet apart from the other walkers is a good idea, but staying physically active is very important. Within your own house, if you can do it, if you have a long corridor, just keep doing that.
Okay. And so we have a question, again, walking related. Somebody who's been walking, this is from Buchi Rama Sarma Rampali. Doctor, I'm 71 and
Yes.
healthy. I brisk walk 5-6 kilometers every day. I don't get breathless even when I walk long distance, but I get breathless even with a slight exertion at home, like shifting the chair from the hall to another room. Why?
So that's a little unusual. 5 to 6 kilometers walk, no breathlessness, but shifting a chair at home, if it's a heavy chair or it's strenuous exertion, I can understand. But a 6 kilometer walk causing no breathlessness at a reasonable pace is a good sign. I think she's doing pretty well. If the breathlessness was unusual, like if she was shifting those chairs very easily earlier, and now suddenly shifting a chair has become difficult, it could be muscle fatigue. So it's very important that elderly patients also do a little muscle training, even if it's with a 1 kilo or a half kilo weight. It improves your overall physical health. And that's why weight training is so important for the elderly. So a good rehabilitation program for the elderly will include weight training, because your muscle mass, Pradyuman, we lose about 1% of our muscle mass after the age of 30. And every year. And after the age of 50, we lose about 2% of our muscle mass every year. So every time you wish a person who's above 50 happy birthday, 2% of muscle mass gone. So I think strength training, though it's not bodybuilding, but just simple strength training can help in that fatigue.
So how much weight would you recommend?
Oh, I think even a 1 kilo weight is fine. Just keep doing it, and do it alternate days so that you give rest to the muscles.
The e-commerce sales are on, people can perhaps buy them.
Absolutely, absolutely. I think it's a very good idea to do it, and it helps, especially if you're pre-diabetic or diabetic. It's fantastic because the muscles take up the glucose, and they don't flood the bloodstream with the glucose.
We have a question from Dhanpal Jain, who says, I was smoking for 50 years. In August 2019, I had a breathing problem. I contacted a doctor. I had many tests. He suggested formaldehyde, Resicape, 2 caps twice every day, and Linium Resicape, 1 caps in the afternoon. I visited last in Jan 2020. Next visit was due after 3 months. Because of the lockdown, I couldn't visit. Should I continue these capsules? My age is 71 and I'm not smoking since August 2019.
Okay, so Haripal, you have been prescribed an inhaled steroid, long-acting bronchodilator, and an anticholinergic long-acting bronchodilator. Now, I don't know if your doctor has explained to you the 3 drugs he's prescribed you, but the 3 drugs that you've been prescribed by the inhaled route are for patients with moderate to severe COPD or severe asthma. 2 messages here. Please don't stop these medication if they've not been giving you side effects and you've not been able to meet your doctor. Please continue them. Your doctor hopefully has explained to you why you need to take these 3 drugs. So please continue to take them. And the second and very interesting observation we've found, in fact, in our research during COVID, is that if you have asthma, I personally believe you have less risk of getting COVID if you're taking a steroid inhaler. We have phoned up now close to 150 patients of ours with asthma on our database, and only 2 have had COVID. And if you look at the CDC website, Pradyuman, asthma is like way on top of risk factors, and actually it's because of alphabetical order. I personally feel that an asthma patient who's on a steroid inhaler is protected to some extent from COVID. I'm seeing it from my colleagues in Canada and the UK, 2 researchers who are seeing the same thing. And just give us some time in this space, and I think you'll get that data that an inhaled steroid could protect you from COVID. But I wouldn't recommend it to healthy people to take right now. But if you're an asthma patient who's been prescribed a steroid inhaler, please take it or continue taking it regularly until you touch base with your doctor.
Doctor, a couple of your patients also have sent in questions.
Sure.
They should be calling you up directly, but nevertheless, I will ask.
No problem.
Rajesh Joshi, I'm one of your patients. Below are a few questions that I would have. It would be really helpful if you could address them. Tightness and heaviness in lungs. Tightness in lungs during fast breathing. Can you suggest any precautions or medications?
So tightness in the chest can be due to two reasons. In fact, two or three reasons. One of the common two reasons are asthma. Asthma itself. If you're asthmatic, you will feel like someone's tied a towel around your chest when you walk fast, if your asthma is not under control. And it's very important that you check your peak flow reading with your peak flow meter. And I hope, Rajesh, if you're asthmatic, you have a peak flow meter with you, and every asthma patient has a peak flow meter with them. It's the simplest way to tell your physician on a video call that your peak flow is good, it's near your best, and that means your tightness is due to some other cause. The other concerning thing with a tight feeling or a heavy feeling in the chest is, of course, coronary artery disease and angina. So, and then your little concern, is it acid reflux or angina? And one of the tests to do there, simple test, is if you feel that tightness, just walk a little bit, walk up and down. And if you see the tightness getting better, it's more likely to be acid reflux, and just take an antacid. But if on walking your tightness increases, you feel more heavy in the chest, I would definitely get down to meet your doctor or to a hospital casualty and get an ECG done. Any tightness, heaviness in the chest increasing on exertion should not be ignored.
Doctor, you mentioned about teleconsult and video consult. Do you do that? Do you recommend that for your kind of as a respiratory physician?
Oh yeah. I have had to get used to that in the last 4 months, Pradyuman. Wasn't the most enjoyable thing, I can tell you initially, but now I find it very nice. It's like when I spoke to my son about his e-classes in St. Xavier's College, he said, no, I'm very happy about it. I said, what makes you happy? He said, many of my classmates don't need to travel long distances to reach college. So I said, oh, you're very compassionate to your classmates. So I said, having said that, I think for patients who stay outstation, it's fantastic. For senior citizens, it's a great idea not to travel to a hospital in this time unless it's urgent. And for anyone who is worried about getting hospitalized, I think it's a good medium. And we are doing e-consults. Obviously, for patients who have COVID, they get priority or who are worried that they have COVID, they get priority. So I've told my secretary who my patients email. So they email me and they copy my secretary, and she prioritizes it based on if they have COVID. 2, if they're senior citizens who cannot reach the hospital from the suburbs or who are even close by at home. And if they're outstation patients, I think those patients can wait because it's usually a routine follow-up and I can tell a local physician to meet them. So we have to prioritize it this way, of course. Acutely ill patients can't be e-consulted. It's impossible, Pradyuman. But I think chronic patients, it's possible. And I'm just seeing so many of my asthma patients are so well now, especially the children, because the schools haven't opened. And so I'm just happy that they're taking the inhaled steroid and they're well. And all other asthmatics who take the inhaled steroid regularly have been well. And we've been just telling them to do that, especially during the pandemic.
So just since we are at it, is there any way in which people can possibly reach you for a teleconsult?
Sure. skrajan@hotmail.com. They email me on my email ID and they copy my secretary, which I can share it with you if you want, sheetalbheda@gmail.com. That they just copy both of us on the email. I think email is the best. I'm not on WhatsApp. I survive life without WhatsApp, I think, because it's so intrusive. And I know I have a WhatsApp number, but it's with the secretary. So we can do WhatsApp calls if patients just love WhatsApp. But I love this medium, Zoom. And I find video consults very interesting in that you're focused. They're mentally taxing sometimes, but you're focused. And I think it's really nice to see the patient's face, see how they, what I don't get on a e-consult is sometimes body language. And what is amusing during e-consult is sometimes there are other family members who have questions who join on at the consult, which is fine as long as it doesn't exceed the time I can actually give them. But I
You don't
usually
have a
give
stethoscope with you, right? You don't. How do you?
the stethoscope. Yeah, that's
How do
true.
you kind of check?
But it's
like that?
actually fascinating, Pradyuman, in that we have realized in the COVID ward, barring a few of consultant colleagues who've got a stethoscope stuck to their ears and who enter the ward with the hazmat suit, most of us consultants aren't auscultating the patient. Now, it's really not important to me in COVID to auscultate because COVID patients don't wheeze. It's a dry cough and it's a structural problem in the lung. So there's not much you're going to additionally get with the stethoscope. So that being said, on a video consult, it is suboptimal. And I would see moving forward, I'd probably do about 70% of my consults physically. And I think 30% of my consults could be video consults. I think waiting lists will go down. And I think the patient comes into focus. I notice very often in India, the patient's on the side and the relatives are in focus. So if the patient has a serious illness, I will find children shooing the elderly patient out of the room and say, talk to us. And I honestly enjoy talking to the patient and then to the relatives. And if the patient says, look, if it's some bad news and I don't want to be told, then I say, fine, okay, I will talk to your children if you want. But I think the right to privacy, which came into effect March 2019, is very important. And I think it is our obligation to disclose information to patients and not to their family first, barring instances where the patient is competent and tells you, I don't want to hear anything. My son is my decision maker. Talk to him. Fair enough. That's okay. But we need to hear it from the patient.
We have another of your patients who, for 15 years, Surendra Mehta, who says, I sometimes have a nose block. Which nasal spray would you recommend?
So one caution here, a lot of people take a decongestant nasal spray. A couple of the brands are Otrivin and Nazivion. Yeah, Otrivin is fantastic to relieve acute nasal congestion if you're on a flight suddenly and you get blocked. But it causes rebound congestion a few hours later when the effect goes away. Otrivin also increases, it contains a drug called xylometazoline. It increases your pulse rate and blood pressure. So I would strongly recommend, Pradyuman, that patients who use frequent Otrivin should be very careful. Ask your doctor about using a nasal steroid spray, much safer and in the long-term use as well. Even for children now 2 years of age, a child can be given a nasal steroid spray and they can be used for long periods of time. As I always tell my patients who are worried about steroids, and I prescribe a lot of nasal and inhaled steroid, is that inhaled steroid is safe for 2-year-olds. It's safe for pregnant women throughout 9 months of pregnancy, elderly patients, and it's safe for Olympic athletes. 15% of Olympic athletes use a steroid inhaler for their asthma. It just tells you how common asthma is and how safe the drug is. There are not many drugs as safe as a steroid inhaler. And that's a message that should get across. People are so worried about steroids. The side effects are there, but that is tablet steroids taken regularly, not topical.
Would you recommend Axe oil and various other such creams for nasal congestion?
No. I have not heard of these creams and oils. I would be very careful. Normal saline, which we give infants to decongest their nose, is quite safe for an elderly person as well. Just simple normal saline drops, naso clear or naso mist. But liquid paraffin drops, please be careful. We have had patients who take it chronically in their nose. They've aspirated into their lung, that liquid paraffin, and it causes what is called a lipoid pneumonia, which can be a serious issue. So I would desist from using those.
We are going to come to pneumonia. We are, 5:40, and the questions we have a total of 55 questions which have come in.
I'm okay to go on as long as you are.
A few dozen here, so I think we can either go on till tomorrow morning or possibly better still do another session with you. We have a question from Vivekanand Malgi who's asked, there are so many suggestions that steam inhaling 3 or 2 times a day will kill coronavirus. In case, as a senior citizen, one goes urgent shopping to a medical shop, is it advisable to go for a steam inhalation and salt water gargling immediately after returning?
No, no, no. I wouldn't recommend that at all. But I would, if I can, advise something about shopping, if you're okay with that. If as a senior citizen you step out shopping, remember 4 things. How long you're going to spend in that shop, how many people are in that shop, how many people in that shop are not wearing masks, and how much time you are actually spending in that shop. So especially closed shops, air-conditioned shops, supermarkets, make your list, pick your stuff, pay your bills, and get out. The more people in that shop, just last week, Pradyuman, I was in a chemist shop, Wellness Chemists, which is a pretty big counter, there's a large chemist counter. And there were 4 people in the store, all wearing masks, but the staff, the cashier, and one of the helper boys were not wearing masks. And I said, you are a chemist shop. You should be setting an example here. The more people not wearing masks in a store, the more dangerous it is. So you got to be observant when you step out to buy stuff. How people are keeping distance from you, how many are wearing masks. And when you come home, I think one good idea probably would be to just wash your face and the neck area, because that's the point of entry of COVID-19 virus is both our eyes, the nose, both the nostrils and the mouth. That's what you need to protect. And so just ensure that you've washed your face well and your hands well, because your hands often touch
soap or wash it with soap or with water, just plain water?
Plain water, soap and water would be ideal. So a face wash is very important. So I have a face wash in my home bathroom, both my clinic bathrooms, because when I leave at the end of the day, even though I use a face shield in the clinic, it's a good idea to just wash face. So if you're coming home from the store, you don't need to have a bath or anything. I think a good face wash and a hand wash is fine. Leave your shoes outside the house. That's a lovely old Indian custom. If you can afford to do that, keep your shoes outside your house. And of course, if you're visiting a hospital, maybe you want to shower when you come back. That's the one. Otherwise, a quick hospital visit to a clinic is not a problem. Many of my patients have been concerned visiting me. We don't have too many clinic visits these days, but I don't think it's an issue if you're seen on time. Spend a little time. The rooms are sanitized well. So if you have to visit doctors at clinics or hospitals, spend the least amount of time. That's the bottom line.
We have a question from Dr. Digesh Patel,
Yes.
who says, I'm a dentist. What would you like to give a piece of advice to all at large about precautions to be taken while working in a clinic? And also, what would you recommend to be done once we are done with the session?
So dental clinics, face shields, extremely important. I'm not too well versed with, I have dental colleagues who have restarted their practices. N95 mask goes without saying. And for teeth cleaning, for instance, if you've got to go for teeth cleaning, I think you could defer that. One of my colleagues told me to buy a shaver if I had to do it myself, which you can clean your teeth on your own. But the aerosolization procedure is extremely dangerous, and I empathize with dentists who have to do it. And I think just take care with patients. Ask them a little history. Have they had flu-like symptoms before they come? It's impossible, I think, to do a COVID-19 rapid antigen test for everyone who visits your clinic. You have to be cautious. There is no need to take hydroxychloroquine. There is absolutely no data that doctors or physicians are more protected if they take hydroxychloroquine. I am not impressed with the data that has come out of AIMS on this drug. We have had doctors taking hydroxychloroquine who have had serious COVID illness just because of exposure. So taking such a drug and having a false sense of security is very, very dangerous. Dentists have to take care. Ophthalmologists need to take care. Wherever you're very proximal to your patient, ENT surgeons. But I think with time, we will be able to triage and screen the patients who are high risk and those who are not high risk patients and who incidentally have COVID-19. Those are the patients, I think, who are unfortunately going to transmit infection. But that's going to happen more during the intensive pandemic phase. So do dental procedures, my recommendations that are really necessary, and try and defer those. And if you're a conscientious, sensible dentist, trust me, the patients who are your patients will come back to you because they will realize you're protecting them and yourself in the process. Once the pandemic settles down, they will all come back.
Doctor, this is a question which, I am perhaps cheating because it's in a sense a fun question, and a lot of people have perhaps been wondering. This is again from Buchi Rama Sharma. Doctor, don't you think we should find out why persons like Amitabh Bachchan and Amit Shah contract COVID? These are people who take utmost care and follow all precautions. Still, they contracted COVID. Once we know the reason behind it, would perhaps be helpful to know more about the spread of COVID.
See, just sitting at home doesn't give you a certificate not to get COVID. At least for Amitabh Bachchan must be having staff at home, Pradyuman, who are moving in and out. I mean, you can't all stay locked up in a glass box at home. So there will be people coming in and out, and there will be contact fomites. So I think, and your background immunity, I don't know what drugs he's on, but we have heard about illnesses in the past. So if your background age is also not completely on his side, such patients are at risk. Again, it's important to minimize contact, and the more staff you have at home, the more you're at risk. So I know one wealthy patient who's got 15 staff at home who get tested for COVID antigen every week, just out of a paranoia. And if you can afford to do that for all your staff, that's fine. But if you have so many staff, your risk goes up. You can't keep all the staff locked up in one place. Likewise, Amit Shah, a person like him, I mean, you see him in meetings. I mean, he's been chairing high-level meetings through the pandemic. In fact, what was worrying is I saw the defense minister and the finance minister with him, in one meeting. And that's really worrying in terms of when you heard he was positive. But you also hear the fact that I'm sure they'll be sensible. I'm sure they'll get sensible advice. He is being treated in Medanta from what I understand. And I would believe that, and he's already, giving out orders on the Air India plane crash I heard yesterday. So obviously he's fully there. A lot of sensible management in COVID is not often there, I find, in that people are getting more drugs than they need, drugs that have no evidence of benefit, doxycycline, azithromycin, HCQS, vitamins. There's no evidence that any of these help. Of course, a vitamin helps if you're deficient, but otherwise, there's no evidence that that protects you against COVID. So I think we need to be a little sensible. A lot of drugs being given in hospitalized patients also without evidence, unfortunately. So we know that in mild COVID, you don't need any drug most often. Sometimes an inhaled steroid helps. There are 6 global trials going on a steroid inhaler now, maybe favipiravir for some patients. In severe COVID, we know that remdesivir, steroids, and low molecular weight heparin are the drugs of choice. So all these 3 are usually on all patients in ICU with severe COVID. And barring that, convalescent plasma, a drug called tocilizumab, Actemra, no great data at all, but I see a lot of patients getting them, unfortunately, and they can create more problems than benefit for many of our patients. So we should question our doctors. And that's the time, the moment you put the question to the doctor, where's the evidence? You will see your doctor, I think, being a little on guard and answering your patients, because then the doctor would say, oh, this is a patient who's asking too many questions. That's our job, to answer patients' questions. If we don't answer patients' questions, I think we'd be doing half our job. So I think I would encourage patients to ask more questions to their doctors. We will get better doctors out of them, I'm sure.
Doctor, there's a question from Nayan Shah. It says, I am total laryngectomy. I removed my vocal cord in 2014 and speaking esophagus speech.
Oh.
What extra care do I need to take?
No extra. So that's a total laryngectomy. No extra care to be taken, though I'm suspecting it must have been for a malignancy of the larynx. And if it was, then you are a cancer patient or a cancer survivor. And I think if that is the case, we need to be careful, because cancer patients take a little longer, Pradyuman, to clear the virus from the system. If most patients clear it in about 10 days, a cancer patient could take 14 to 20 days to clear the virus from their system. So that's the only precaution. Quarantine would be extended, and I did see some questions earlier from you on quarantine, but I'd be happy to take that, because many patients ask that question.
That's right. We have a question about from Viren Mongia, and another question about what kind of exercise would you recommend? Does pranayam work? Does yoga work? What is the kind of exercise that you would recommend?
Any exercise that is physically active, hatha yoga, walks, running allows you to exercise for a shorter period of time, cycling, not just walking. Some people believe that just taking one long 1 hour walk is all they need. Remember that it actually shortens your hamstrings, so you must stretch your legs before the walk and after the walk. And I would say if you can combine 20 minutes of walk with 15 minutes of weight training and 15 minutes of cycling, that would be fantastic, because that sort of exercises your quadriceps, your upper arm muscles, and your cardio, which is your walking. So it's good to have a balance of all of these. Yoga is a fantastic exercise, focuses on breathing. So I would strongly recommend yoga for anyone who practices it, and for those who don't, to learn it. It's inherent in Indian culture, and I think we underuse it sometimes.
Doctor, so many questions coming in. We have Abhinay Thakkar, Gaurang MK, Jyoti Mukesh, Digesh Patel, Jyoti Taparya, Jikesh Patel asked about steam inhalation. We've already answered that. Vinita Chandra, Nalini Gupta.
Can I take one question on how long people are infectious? I think someone asked that.
Yes, that's right. I was going to ask you that.
That everyone should understand that if you get COVID, I think you are most infectious, you must realize. So if you you started your fever on today, 8th of August, then you are most infectious from the 5th or 6th of August to about the 14th of August. 3 days before and 5 to 6 days after you first had symptoms. Remember that. So the contacts you had in the 3 days before you had symptoms and the 5 to 6 days after are the most at risk. Most people under the age of 50 clear the virus in under 2 weeks. So by 10, 11 days, they're almost non-infectious. If you're over the age of 50, it can sometimes take up to 3 weeks. Or if you had very severe COVID, it can take 3 weeks. So that's why the quarantine guidelines are a little more stricter in India, I noticed, than the rest of the world. And so I would say from the time you had COVID, 3 weeks is really the outer limit for quarantine. After that, you can step out.
And from your experience, what are the kind of symptoms that are very common in India? What are the kind of symptoms you need to be careful about?
The commonest symptoms I've seen in the now 1,500 patients coming out of the 2 hospitals I work, Bhatia and Bombay Hospital, has been a sore throat and fever, Pradyuman. And for the 10 to 20% who have severe COVID, breathlessness, of course, is a symptom, but the breathlessness comes after day 6, day 7, not in the first few days. This is the hyperimmune response to COVID. So sore throat, fever, cough. Cold, not a very common symptom at all. Loss of smell, loss of taste, and in about 20 to 30% patients, diarrhea. So these are the commonest symptoms we see.
Body ache, etc., which is
yes. Sorry, I forgot to mention that. Fatigue and body ache. Fatigue and body.
In terms of fever, what is the kind of fever that one should be careful about?
Any fever during a pandemic. So just 1 or 2 days of a low-grade fever, I wouldn't panic about. But if it's more than 2 days, rising fever, blood counts, get a CBC done. Your blood counts suggest a viral infection. I would recommend doing a swab. Unless you're in a household where 3 other people are also positive, it's likely you're positive, and you're young, you could probably avoid testing in such a situation. But if you're someone with comorbidities, the reason we are more cautious about someone with hypertension, ischemic heart disease, diabetes, cancers, or chronic kidney disease is because they develop the hyperimmune response and complications much more often. That's why we advise that they are observed in a hospital, or if they're managed at home, very carefully monitored by a good primary care physician or their consultant online once in a few days, just to be sure they're well. And I think this gets us back to this thing that you must have a good primary care physician. I think post-COVID, the importance of a good GP is going to go up like anything. So you must find a good primary care physician whom you can trust and who can answer your questions in a way that builds confidence in you, puts your priorities, and not someone who is not competent to manage you or who sees you with very little time and who refers you to a specialist very fast. Those are primary care physicians I would be cautious about. And I think that's why primary care consultants, just like our specialists, have to update themselves. You know, we find they take up too many patients. They don't find time to update themselves. And therefore they, as physicians, we give substandard care. The more patients I see, Pradyuman, the less time I have to update myself, the poorer the quality of my care. So I think we should strive to see less patients. I think a lot of patients can be managed at home, like we have seen in the last 4 months.
A couple of more questions. One is on the vaccine. Do you recommend people taking an influenza vaccine or whatever else exists given the fact that the coronavirus COVID-19 vaccine will take some time to come?
So I'm a very strong proponent of vaccines. I actually stock the pneumonia and the flu vaccine in the clinic. But Pradyuman, during a pandemic, at the height of a pandemic, I would not advise vaccination. It doesn't make sense at all. 2 reasons. The flu vaccine has just come, and now I would say if anyone wants to get vaccinated, they should get vaccinated around September, October, when the next flu season begins and when things would have opened up. So September, October, the Southern Hemisphere strain for Indian patients, not Northern Hemisphere, even though we're in the Northern Hemisphere. And it's a quadrivalent flu vaccine. Hopefully it contains the coronavirus vaccine as well by the end of the year, but if not, the quadrivalent. The pneumonia vaccine does not protect against COVID pneumonia. Many patients seem to believe that taking a pneumonia vaccine protects them against COVID pneumonia, not at all. But it's a very good vaccine, the conjugate pneumonia vaccine called Prevnar. We give it to all healthy human beings after 65. I would strongly recommend it. And for the patients who are willing to take it, it's just 1 dose. And then there's a polysaccharide vaccine you take 5 years later or a year later if you have many other illnesses. These 2 vaccines, another vaccine for elderly patients is the herpes zoster vaccine. I would strongly recommend, but not available in India, unfortunately. So you have contacts abroad who can get it. Herpes zoster, for any of you who have suffered for it, is a very painful rash and can be debilitating illness. So I would strongly recommend it when that vaccine is available that everyone takes it.
Well, there's one question which has been asked for almost every other session of ours. Is it safe to interact with technicians coming for blood tests? Is it okay to get your domestic help at home? Most of the people, of course, have given their advice. What is your view now that we are at this stage of the pandemic?
Sure. So, Pradyuman, there's a point here that you cannot control individuals and their behavior. I think we need to understand that in society at large. I mean, I cannot control people in my own building, right, on how they behave. You can put up a rule. Some people will break the rules and you can't keep getting police to enforce rules. So in this respect, as far as the first question you asked was about, what was it? Sorry, I forgot what.
About blood test technicians.
Yeah, blood testing. Yeah. So the first question I would put in the person's mind is how much is that blood test needed? If those blood tests are required, just take your precautions and get it done. Now, if you're doing your annual health checkup right now, you can defer it. I don't think that is an emergency right now. But if you need to do blood tests for any particular reason, you're monitoring a cancer, you're monitoring your tuberculosis, an infectious disease, you're testing for COVID, for sure you need to do it. Just do it safely. and the person who comes to collect blood will be taking precautions, you also need to take precautions because you're meeting a new contact. That is reasonably safe, I would say. The second question about part-time maids, I think there's no blanket rule here either. A lot of people have asked me about this question, and I think if there's an elderly couple or a family is really having a tough time coping at home without their part-time maid, fair enough, keep the part-time maid. Just see that the part-time maid comes for the work necessary. I'm sure the family that employs the part-time maid understands the risks of keeping a part-time maid, and so therefore allow the part-time maid to work in a room while the other members are in another room. See that she or he washes their hands uh, and leaves as soon as the work is over. Having said that, if that part-time maid is going to step out of your house and go and have a chat with some other part-time maids and loiter around in the building, that's a recipe for disaster. And that kind of behavior is impossible to control, you know. So I don't think it's a problem. Of course, another thing I would emphasize is that if a part-time maid has symptoms, I would tell that part-time maid or servant that please don't come home. We will pay you to stay at home if you have symptoms. And I think that's our responsibility should be. If you have anything like a fever, a body ache, don't be obliged to come home because we are paying you a salary. Stay at home, get well, be sure that you're well for at least a week to 10 days and then come back to work.
Thank you very much, Dr. Rajan. It was, thank you for spending over an hour here asking questions, and we haven't asked even 1/3 the questions.
No problem. We can do it again.
I'm going to come to you again for a Q&A sometime. And you know, there are so many senior citizens out here who are asking questions. There are people asking questions for their parents, and there are some people who are young and energetic, but they have some issues. So thank you very much for being here. We're going to have another session of Health Live at Seniors Today next week. We have Dr. Eric Burgess, who's going to be there in the house next week. So do join us at that time. And thank you once again, Dr. Sujeet Rajan, for being here and for answering as many questions as you could. Thank you very much.
Thank you.